circumstances around each death are, so that we can pick up a pattern of what are the common features, or what's underlying characteristics in people that go into severe to critical state of infection. So far, the common denominator is usually advancing age. It's underlying metabolic syndrome. And what does that mean? That's anybody with diabetes or hypertension. Those two disorders are described as the metabolic syndrome. And then anybody who has underlying condition that affects their immune system. Obesity, we find, is also a possible risk factor. So when we see patients who come in with those types of phenotypes, in other words, metabolic syndrome, advancing age, underlying immunological problems, then we immediately triage them as high risk, even though they may not have presented with high risk features. We pay particular attention to those. Those are the type of people that we really want to watch very carefully. And moving forward, we're looking at ways in which we can inform the public that if you fit into any of these categories, you need to be particularly careful. For example, if there's a person with the infection in a home, before you are evacuated, you want to keep granny and grandpa as far away as possible and practice those kinds of social distancing and personal hygiene as much as possible. So these are the kinds of public health interventions we're looking to moving into the future. Now, when you look at our death rate statistics, it's very low. And there might be a number of features that are responsible for that. I've mentioned before that Lagos has a particularly young population. Our demographic profile is young. There might be some environmental factors. We live on the equator. In the equator, we are exposed to quite a number of other corona-like viruses, not COVID-19, but corona family has got thousands and thousands of strains. So it's quite possible that, we've been exposed to different strains of coronavirus in this environment. There are lots of bats around, we all live close to the ecosystem, so it's possible that there is some degree of cross-immunity operating in this environment together with the young age group. Our diet may have something to do with it. Most people in Nigeria eat a traditional diet, which is a lean diet. And so obesity is not necessarily a predominant feature that we see in this environment. When you look at places like the United States, then you see that, obesity and metabolic profiles are becoming a problem there. And that may be accounting for some of the excessive mortalities that we're seeing in those climes.
Let's speak to those asymptomatic patients. About 60 to 70% of people that would be infected with COVID-19 show little to mild symptoms, even though they are still secreting the virus. Now, what does that mean for our testing rate in Lagos? Are we